Hello people, we want to start off with the tumors of bone. Just the classification of tumors of bone has been asked 3 times. So please pay attention here. We're discussing what? Bone. So shall we dive in? Let's look at the classification of tumors, bone tumors, okay? So basically, primarily the bone tumors are classified on the basis of the histogenesis and the histologic criteria, and they include osseous and non-osseous tumors. So they can be benign or malignant. So what and all are the criteria for classification? The histogenesis and histologic. That means how it became like that. Histogenesis and histologic criteria is the basis of classification. Here you will say osseous tumors and non-osseous tumors. And then again in that you have benign and malignant. Okay. Osseous is something related to the bone. Okay. Bone forming, cartilage forming, hematopoietic, unknown, notochordal. But non-osseous is everything around it. Vascular, fibrogenic, neurogenic, lipogenic, histiocytic, etc. Okay. In this, we will be focusing more on the osseous tumors, okay, because that is more related to the bone, correct? Very, very closely related to exactly the bone. So let us look at the osseous tumors. We have the bone forming, that is osteogenic, osteoblastic tumors. Then we have cartilage forming tumors like chondrogenic. Then we have the hematopoietic marrow tumors, unknown tumors in which we have the osteoclastoma, giant cell tumor which is the benign. Then we have the notochordal tumors. Let us just look at details on this. Benign and malignant. Bone forming, osteoma, that's why it's benign, right? Osteoma becomes osteosarcoma. Then you have osteoid osteoma. Are you able to see, guys? Shall we zoom? Okay, so currently we are looking at this portion of it. Currently we are looking at this portion. The bone forming, bone one. Okay, bone. So bone one, what we have? Osteoma, osteosarcoma. Osteosarcoma is very important. Has been asked extremely many times. This osteosarcoma has been asked. So you should know that osteosarcoma is malignant counterpart. Benign is osteoma. So age also you can check all that. We will come to the details. Then you have osteoid osteoma and osteoblastoma. Okay. Osteoma, osteosarcoma. Osteoid osteoma. Oopsie, so much to know. Just remember osteoma, osteosarcoma, then osteoblastoma if you want, you can remember. Moving on, let's move on to the cartilage forming. Cartilage forming, you have chondrogenic tumors. So you have the Chondroma, that will become chondrosarcoma in malignant. Osteochondroma, chondroblastoma, and chondromyxoid fibroma. So much to know, guys. What has been asked in the exam is highlighted here, or chondrosarcoma. Okay, asked in the exam. That counterpart here is chondroma. Chondroma, chondrosarcoma. Okay. Then, hematopoietic marrow tumors. You have myeloma. Multiple myeloma is just myeloma. Then you have lymphoplasmacytic lymphoma. Myeloma, lymphoplasmacytic lymphoma. Hold on. So this myeloma is blood rising from plasma cells. Okay. Lymphoplasmacytic lymphoma. Moving on. Guys, is it clear? The hematopoietic is clear. Hematopoietic is clear or not? Wait, we'll give you a wake-up call. That's better. Currently, we are studying the tumors of the bone. Now, we are looking at the osseous tumors. That bone-forming tumors we saw osteoma, osteosarcoma. Then cartilage forming, we saw chondroma and chondrosarcoma. Then we saw hematopoietic. Hematopoietic, we saw in the malignant, we saw multiple myeloma and lymphoplasmacytic lymphoma. Now, coming to the fourth one, unknown. Unknown, they have something called as a giant cell tumor, osteoclastoma. Giant cell tumor, osteoclastoma is also important. Remember, osteoclastoma is benign condition of the bone. Then you have the malignant giant cell tumor. Same giant cell tumor, if you put off malignant, it's malignant giant cell tumor. Then you have Ewing sarcoma. This will affect the diaphysis, correct? So Ewing sarcoma you should know. Then you have adamantium adamantinoma of long bones, like it's adamant. Adamantinoma of long bones. Wow, that's malignant. Adamantinoma of long bones. Okay. Then coming to the fifth category under osseous tumors, you have notochordal tumors, in which you have chordoma. This chordoma is very famous, I think, because I have seen it in some MCQs. Chordoma. I was thinking maybe it's some spelling mistake. Instead of chondroma, maybe they wrote of chordoma, but this is different. Chordoma is here and chondroma is here. So this chordoma is notochordal tumor. Fine, got it, guys? So we are concentrating only on what? Osseous tumors. Because this chapter is all about bone. Something related to the bone, everything will be there. That also we'll check. Wait. Okay. Can we scroll down a little safely? Nope. Don't allow me to scroll down only. Anyways, we bring it down till here. Non-osseous tumors, we have vascular tumors, hemangioma. All these are different. They don't come exactly under the bone. That's why they have not put here. Hemangioendothelioma, angiosarcoma. Hemangioma is actually benign. Angiosarcoma is malignant. Then we have fibrogenic. We have non-ossifying fibroma, fibrosarcoma. Neurogenic, you have neurilemoma, neurofibroma. Then here you have the same thing, neurofibrosarcoma. Here you have neurofibroma, here you have neurofibrosarcoma. Then when it comes to the lipogenic tumors, you have lipoma, liposarcoma. Then histiocytic tumors, fibrous histiocytoma, malignant fibrous histiocytoma. So, I think mainly you have to remember these osseous tumors, bone forming, cartilage forming, hematopoietic, very easy, unknown, God knows what they're trying to say there, and notochordal tumors. Close your eyes and tell me close your eyes and tell me what you have seen. Bone forming, osteogenic or osteoblastic tumors, you have the osteoma, and the malignant you have osteosarcoma. In that also two types, there are classic and surface osteosarcoma. Then we have the cartilage forming, so that is something to do with the chondrogenic tumors. In chondrogenic tumors, you have the chondroma. Then we have in the malignant, we have the chondrosarcoma. Okay. Then there also we have a chondroblastoma. Here also you have an osteoblastoma. Here you have a chondroblastoma. Then hematopoietic, that is the marrow tumors. You have the multiple myeloma. Then we have the lymphoplasmacytic lymphoma. Then in unknown we have the giant cell tumor, that is the osteoclastoma. This also has been asked in the exam. Then you have the malignant counterpart, which is the malignant giant cell tumor. Then you have the Ewing sarcoma, which affects the diaphysis. Then in the notochordal tumors, you have the chordoma, which is also malignant. Though it looks like a oma, it is actually malignant. Okay. Guys, did you understand the classification of tumors of bone? So, classification itself has been asked 3 times, guys. Apart from this, you can write some things like blood vessel tumors, lipogenic, fibrogenic, then neurogenic, histiocytic tumors, etc. After that, we will move on to some points about each of these tumors. We will come to that. This video, we will try to come back to these points. Then we will look at the details of osteoclastoma, because osteoclastoma is benign, if you remember. Osteoclastoma is the only benign condition that they have asked in the exam. Everything else in the exam they have asked are malignant. Osteosarcoma, we saw that there are 2 in this. Which one? We have the classic and the surface, correct? Classic and the surface. So, can you see this? All the ones in yellow which are highlighted, these are the ones they have been asked. They have asked in the exam so far. So, you can see osteoclastoma, which is a benign condition. It's the only benign condition they have asked in the exam. Osteoclastoma or giant cell tumor. If they ask the malignant counterpart, then you will have to write the malignant giant cell tumor. Then you have the osteosarcoma, chondrosarcoma and Ewing sarcoma, which have been asked in the exam. We look at the details of all these in the coming videos. Enjoy. Bye. For now, it's bye.